Previously in my video, I wanted to discuss, or I said I would discuss my gene anomalies more in depth. And so I did get a genetic testing. I went through, it's called Myriad My Risk, and they test you for hereditary cancers. And so I had, I believe it was, I want to say 23 or maybe 25 different genes tested. And I did come back BRCA1 and BRCA2 negative. And so those two genes are the genes that are cause a higher risk for breast cancer and even ovarian cancer. So I tested negative for those. With testing negative for those, that left the option for my surgery to be as little as a lumpectomy. If I chose to do mastectomy, I still could do it, but there's no real correlation between survival with a mastectomy versus a lumpectomy with my risk factors. And then, of course, there's also prophylactic double mastectomy, which is also an option. And not that it's not recommended, but based on my risk factors, it's not necessary at this time unless I just want to do it. And I'm still thinking about what my options are, because with triple negative breast cancer, the recurrence rate is so high. And then when it tends to reoccur, it tends to spread to things like your brain and your liver and your bones. And so as I move forward in my treatment plan, I will make a more firm decision on where I am on surgery and how I want to move forward with that. So, again, I think they tested 23 genes. BRCA1 and BRCA2, I was negative for. I did come back positive for a gene called BRIP1, that's BRIP1, and it lends itself to interpretation of a higher risk, a higher cancer risk, and that is something that I have to consider with treatment as well. And the other gene that I came back with is called NBN, and it shows an elevated cancer risk. So those two raise my risk for breast cancer and possibly ovarian cancer. So what I've discussed with my oncologist is that I will probably have prophylactic oophorectomy, which means removing of the ovaries, and they recommend sometime between the age of 45 and 50. So I have about 5 to 10 years to decide or to schedule that. And if you looked at my last video, you know I don't have any children. I did go through infertility treatment, IVF, just to save eggs for future implantation and pregnancy. So before I, of course, have an oophorectomy, I definitely want to try to use those eggs. So that's something I don't have to think about right now. The risks are higher for me, but they still believe, you know, between the ages of 45 and 50 is when you would want to have that prophylactic surgery. Then the last gene that I had anomaly for is called ATM. Now, this came back with the interpretation of uncertain clinical significance. And what that means is they really don't know if it is a real anomaly or not. I could be tested later. They could change the interpretation. If I were to have that particular, and it was confirmed that I had an anomaly on the gene ATM as well as the NBN and the BRIP1, it would sort of be like a medical anomaly, like super rare, and would be cause for publication in medical journals. So I don't know for certain. And so right now we're just keeping it at uncertain clinical significance. They don't know if it raises the risk. There's not been enough studies on it to determine if it raises the risk for breast cancer or any other type of cancer. So one of the other things I learned is that some of these anomalies, because they're hereditary, you would imagine they, typically be passed down from your mother, your grandmother, whatever. But one of them could possibly have been passed down from my father's lineage, because in having, I believe it's the NBN, but don't quote me, it might be the BRIP1. In men, it causes prostate cancer. And so, that's a sort of men's disease. So, with the genetic testing, I recommend, if you're facing a battle of breast cancer or if you have high risk in your family, just to go ahead and get the testing done. Sometimes insurance covers it, sometimes it doesn't. If you're at a higher risk, your insurance is more likely to cover it. And it just kind of helps me get a better picture of how I want to move forward with treatment if I need to have any type of prophylactic procedures, like I said, and determining how aggressive I need to be with the current treatment plan. So as of right now, we're going to continue with the chemo. I will, at the very least, have a lumpectomy on whatever is left of the lump in my breast, and then radiation. And at this point, I don't know how many rounds of radiation, when surgery will be. We're just focusing on getting through the chemo. And with chemo, I have 8 cycles, which I usually go weekly. And so it's about 8 weeks. Typically after chemo, you have a small rest period, unless the cancer is, growing significantly or something like that, before you move on to the next phase of treatment. So I am looking forward to a little bit of a rest, because going to chemo every week, it's like just when I barely get to feeling better, it's time for chemo again. And I do have some anxiety about it. Just feeling bad and feeling down and laying around. I have been starting to get kind of tired of my day-to-day. I can only color so much. I can only enjoy reading so much. Tired of watching TV. But sometimes I'm in so much pain, all I can do is lay around and stare at the walls. I don't have a lot of visitors because it's wintertime. A lot of people are sick, and I don't need any type of infection. And a lot of times I'm just not up to visitors even, to buy time. So it's getting monotonous, and it's kind of hard to stay, positive, because the day-to-day is basically the same. I wake up, I eat my breakfast. If I have the energy to work out, I work out. And then I usually have to rest. You might eat my lunch. Talk to friends or family on the phone or what have you. And then I could have a pain episode where I'm just trying to hold on, because sometimes it's so painful to where just tears just spring out of my eyes. So, I'll do a few days of that, and then the next thing I know, it's time for chemo again. So I'm still lucky in that I haven't had any super adverse side effects. Most of the side effects I have are pretty normal through the course of treatment. And so just trying to hang on. And I'm technically halfway through chemo, which is exciting in and of itself. Because it seemed like, when I first found out, I was like 5 months of chemo. That just seemed like so, you might as well have told me it was going to be 5 years at that point. And now that I'm halfway through chemo, and about, I guess, maybe a third of the way through total treatment, it feels great. So that's pretty much it. So again, the genetic testing I went through was called Myriad My Risk. There's other programs, I'm sure, that do genetic testing. If you have family members or if you yourself are going through this situation, check with your oncologist to find out what's available to you so you can find out your risk factors. It's better to know than not know and be surprised. If you are dealing with cancer, I know it's hard. It's definitely hard for me. Every day it's a fight. It's a struggle to stay positive, to stay strengthened. But, you know, what is the option? If you're not ready to go, the only option is to fight. And so stay the course. Make sure you make it to your treatment plans. Try not to waver. See your doctors. Eat well. Try to maintain an active lifestyle if you can. If you're up to it, it all helps. What else? I think that's it. So that's pretty much the update for this video. Probably in actually, I don't know when I'll do another video, but I do thank you for watching. I thank you for praying for me and supporting me in the ways that you have out there if you're watching, and pass this video along to someone else who might be going through it. It is one thing to have your family and friends who support you, but it's another thing to have someone who really understands what it really feels like to go through it. You know, they say cancer just doesn't happen to the cancer patient. It happens to the family, but the ins and outs and the integral parts of it is very personal to that patient, and only other patients really understand. Your doctor doesn't completely understand it. Your family won't completely understand it unless they've been through this exact thing. And so if you do have family who may be having trouble going through their process, and just knowing that there are people out there that are going through the same thing, share the video. I'm always open to talking about my journey in the process and answer questions. So anyway, I hope you all have a wonderful day. Happy New Year to you all. And we're just moving forward with health and continuing this battle, and hopefully in the end, I will be victorious, a survivor. So anyway, have a great day. Bye.